Hi everyone. September is celebrated as PCOS Awareness Month across the globe. 1 in 4 women across the globe are suffering from PCOS. So today we're going to be talking all about PCOS, what causes it, what are the signs, how can we really help women who are dealing with it through lifestyle and diet. Number 1, please understand PCOS, as the name suggests, is Polycystic Ovarian Syndrome. And it can have external and internal manifestation. When we talk about external manifestation, irregular periods, weight gain, difficulty in losing weight, acne, especially cystic acne, hair fall or male pattern balding, dark lines in your neck region, which is called acanthosis, which is also because of insulin resistance. And we're going to talk about insulin resistance in a little bit. So these are your external cause. Now, when it comes to internal cause, internal manifestations, there could be depression, there could be fatigue, there could be weakness, there could be very, very varied appetite. Insulin resistance, like I said, also it can cause mood swings now and anxiety. So these are the manifestation. What causes PCOS? PCOS can be genetic and PCOS can be lifestyle induced. So one needs to see what is the real cause in a woman's life. A study concluded that 80% of the cases, if a mother has PCOS, the daughter is at a higher likelihood to have PCOS if not taken care properly. Now, when is PCOS diagnosed? PCOS can be diagnosed anytime. It can be as early as a girl attaining puberty and having irregular periods, or it can be any time throughout your reproductive life. So you can have PCOS at any point of time. How do you diagnose PCOS? You need to fulfill 2 criteria out of the 3 that I am going to now tell. Number 1 is irregular periods. Number 2 is high androgen hormones, which is male sexual hormones, testosterone. Women also have testosterone, but in a very, very limited amount. However, when you have PCOS, the testosterone levels are way too high. Number 3 is the ultrasound. When you do an ultrasound and if you find that the ovary size are large and there are cysts around your in your ovaries is when, so if you have irregular periods and cyst in your ovaries, or if you have irregular periods and high androgen levels, or if you have high androgen levels and cyst in the ovary, you are a PCOS case. Now, what happens when you have PCOS? When you have PCOS, there is insulin resistance in the body, which means the fat absorption is much higher. Number 2, the pancreas, every time you eat, the pancreas are releasing insulin, because insulin's job is to, transport that glucose in the cells, which is being released through food. However, pancreas are releasing the insulin. Insulin works as a courier guy, knocks at the cell door, but the cell is not opening the door for glucose to get in because there is insulin resistance. So now there's confusion. Pancreas is seeing that there is glucose flowing in the blood, so it releases more insulin. However, the cells are not opening the door. So the cycle continues and thereby there is insulin resistance. So that makes it very difficult for a person to lose weight and for a person to control the condition. Now, when you visit a doctor, you are given medication, which could be a type 2 diabetes medication, which will basically work on your insulin resistance, or you're given oral contraceptive pills if you have irregular periods. Is that the cure? I'm sorry, unfortunately, that's not the cure, because PCOS, honestly, there is no cure. You can manage the condition or you can reverse the condition with your lifestyle and diet. So what do you do then? You use a lot of superfoods or a lot of Indian herbs and spices in your diet, which works on your insulin resistance. So So methi dana and cinnamon are a good thing, are a superfood when it comes to PCOS. So adding cinnamon to your diet, adding methi dana to your food, or soaking methi dana over the, overnight and having that water in the morning can really help you when it comes to insulin resistance. Number 2 is to make sure that you're absolutely away from anything which is refined and processed, because the moment you have something refined, your blood sugar levels are going to rise. There's going to be a spike, and then the whole process begins again. Like I said, insulin will be released, it will go to the cell will not open the door. So you need to make sure that you are not giving any kind of food to your body which can cause sugar spike in your body, which makes which brings us to a point that your food has to be wholesome and whole grain. So millets are a good source for you. Let's say whole wheat and absolutely no maida, no refined grains, no polished grains is what you should be looking at. Next is protein, which is extremely important. So, let's say basically we are getting to a low glycemic index diet. So when we have low glycemic food, our sugar levels are stable and thereby our condition is managed well. Now, let's say if you are having just rice, let's say a Zira rice, obviously it is going to have a very, very high glycemic index and you're going to have a problem. But if you mix the same rice with some dal, with some curd and a lot of vegetables, it will be more satiating. The glycemic index will come down of the food and you will be able to experience good, good nutrition. So you'll be able to lose weight, you will not have sugar spikes, and you will be able to manage your PCOS. So what becomes important? Protein and fiber when you have PCOS. So you need to make sure that there is protein in each of your meal when you have PCOS, and there is enough fiber in your meal through fruits and vegetables. In fact, adding some sort of soluble fiber, maybe psyllium husk or oats bran is also a good option if you have PCOS. Next on the chart is exercise, extremely important. You need to make sure that you do aerobic exercise. It can be swimming, it can be jogging, it can be running, it can be brisk walking, anything for fat loss, and club it with some sort of strength training at least twice a week. If you follow this kind of diet pattern with exercise and follow a very good sleep regime, you will see your periods getting better, your acne getting better, your energy levels getting better, and thereby if you continue it for 2 to 3 months, you will be able to reverse your condition of PCOS. If you have any more questions about PCOS, put them in the comment section and I will get back to you. Please make sure that you follow the tips and reverse your PCOS condition. Thank you for watching. Take care. We'll talk again.